morning, everyone. This is a virtual meeting of the Board of Health for January 19th at 10:30 in the morning. First, approval of the minutes for December 15th.
Make a motion to approve.
I make it, second it.
All in favor?
Aye.
All right, okay. We have no new business, so we'll go directly to old business. Body art regulations update. Sigal?
Sure. Chairman wanted update on both 3A and 3B, the body art regulations and the tobacco litigation. So if it's okay, I'll do them together.
That's fine.
Not much of an update on the body art regulations. It is still on our radar, and we want to make sure that we have yeah, if you could mute when you're not speaking, just so we don't have the feedback. But we are looking at talking to MAHB to see their draft regulations, and also discussing with maybe a contractor to do the research and present with us with a first draft to sort of take the burden off the department right now, because we just don't have the capacity yet. We don't want that to fall behind too much. So just wanted to update the board on that. Not much new, but that it hasn't fallen off our radar. And then also quickly with the tobacco litigation, you all received a copy of that letter, which updated the recent activities. And I did talk to the attorney, and I made some notes here to help me sort of explain. Not much we have to do at this point. We don't need to do anything. The claim has been pending for quite a lot of time, and the plaintiff, I'm sorry, the plaintiff is looking for monetary damages from the town for the time when we passed the regulation to when the state passed the regulation. But the town actually can't be sued for monetary damages because of sovereign immunity. So the attorney has filed a motion for judgment. And the way they explained it to me was the outcomes were obviously, that they expect sovereign immunity would apply in this case, and that the regulations are lawful. That obviously there could be a judgment that sovereign immunity doesn't apply and the regulations are not lawful, but that's very unlikely. So they have filed this motion, but we still probably won't have a resolution for a couple of months because the plaintiff will respond, and then the judge will review the information. But I still feel like we're at a good spot, plenty of precedents. The regulations are lawful, and we have plenty of information in the regulations explaining why we did that. And again, also it really backs up our case that the state has done something similar. So even if our regulations are unlawful, we still have the state regulations, which are pretty much the same. But no action necessary at this point.
Thank you for the update. It just was concerning when I got several emails from the lawyer, so from the company that is suing us. So I want to make sure that everybody doesn't answer those emails. We just let Sigal and the lawyer for the town handle it so that we don't get conflicting issues going on. So that's why I wanted the update. Okay, and then moving right along, COVID-19 update. I'm sure there's a lot there.
So just like last month, a lot of this will overlap with my director's report because it's pretty much 100% of what we do at this point. We are very excited to be moving on to the vaccine phase of the pandemic response. We have really allocated most of our resources to that effort, which on a side note means that with contact tracing, a majority of our cases are going to the Community Tracing Collaborative, which is the state contact tracing entity. I think if we had unlimited resources, we would be able to do that. But I think focusing on the vaccine effort is really going to move us to the end of the pandemic. So we're really excited and believe that's a good allocation of resources. Last week, we vaccinated our first responders. We did 110 first doses of the Moderna vaccine. That got a lot of media attention. We're really excited that we were able to do that. We're going to continue offering vaccine to those eligible in phase 1. Around the public. The state has a phased approach to distributing the vaccine. It's very detailed on the state website. And within those phases, there are different populations listed in chronological order. There are still some populations in phase 1 that haven't been reached yet. We expect those to open in the next few weeks. Really, by the beginning of February, all of phase 1 should be open. We will be having, starting next week, clinics that are open to those eligible in phase one, where whatever bullet point we're at, and that's determined by the command center in the governor's office. Those, if you go on the state website, I always say the who and the when is really well shown on the state website, and it shows it's a very detailed list of who is eligible, and that changes regularly. They indicate to us that every Tuesday and Thursday it's updated if there are movements in populations, and also the where. There's a searchable map where you can look for clinics in your geographic area that you can attend. The biggest one in this area will be Gillette. They're hoping to ramp that up to 5,000 doses a day. I think it'll run 24/7, so that's ramping up right now. But we will also be vaccinating here. Like I said, those that are eligible, and we will be on that website too, our clinic. They will, we also will be running small closed clinics targeted to specific populations that we can reach. And I think an example of that is at the beginning of phase two, which we hope will be a little into February, the housing authority residents will be eligible. So that's another great target population that we can sort of bring the clinic to and run clinics at the different housing authorities. Those are obviously seniors that are high risk and living in close quarters, which puts additional risk. So we're happy to get them vaccinated soon. Another great population in phase two will be a lot of the town staff, such as teachers and public works and light department employees. Those will all be in the second bullet in phase two, which, we don't know the exact dates, but we're hoping, February, March, that we'll reach those.
Can you just tell me the website so that we can make sure that people hear the website from us that they can go to?
Sure. The best way to get it is to go to mass.gov/COVID vaccine.
Okay.
And there's all sorts of links there. We are getting a flood of phone calls asking questions, and unfortunately, we know whatever's posted on the state website. We don't know anything more. Understanding that not everybody has access and the ability to go on the state websites, and we'll try to answer those questions as best as possible. But for the majority of the population, really encourage them to go look there for the answers.
So may I ask some questions? Okay, good, Joni, I'm fine.
Want to say that again, please? The website.
It's a state website, mass.gov/COVID vaccine.
Okay, thank you.
Sigal, do we have any significant determination of how many vaccines we get? Or is it just we get what we get? Do we request 1,000? Do we request 300?
It's a comment. We do request it on a weekly basis. And actually, you know what? Stacy's the one that actually does it. So I'll throw that to her to answer.
Hi. Yes.
Hi.
So last week we were actually ordering for 8 communities. So we'll actually 10 communities, because we were covering 2 people, 2 of the communities that we work with for first responders. So we were ordering for all of them, and we were the depot. So what they were doing is they were coming here and picking up the vaccine, because the state could only really ship to one place, one town, until they got everything up and running and every community signed on. So starting next week, we'll be able to order just for our community. So yes, it depends on our target population. So you have to prove that you've given the previous orders vaccine. So our previous order, like Sigal said, 110 for first responders. So once that is in the system that we gave it, we can order again for the next week at our target population.
So if we have more people that are able to give the vaccine, Stacy, can we order more?
Well, they don't give us what we order. They'll give us a percentage of it. Yes.
Okay.
So we don't know. We can ask for more, and they tend to cut us in half.
Okay, because between the staff, the Board of Health and the governor talked about COVID facing. Now I understand from several people just telling me that they've had their vaccines and they're not COVID facing. I'm not saying specifically in the town of Norwood. I'm saying not in the town of Norwood. But other medical people that would be in phase 2 and now phase 1, but are still not COVID facing. So we're still getting my question is, we're still getting our rules and regulations from the feds. where does this come from? What is in the first category? What is in the second category? That comes from the state, the CDC,
Yes,
the feds.
website, just what Sigal told you. So the governor rolls it out, tells us which, so the federal is a little different from the state. The state can change it. So in Florida, you can be, I believe it's 65 and above are being vaccinated right now. Massachusetts is a little different. Each state can tweak it depending on their supplies of vaccine and their rollout and their capacity to get it out to people. So you got to remember too, Carolyn, we're a portion of the vaccinators. So for instance, medical offices have their own avenues. Some people have.
They do. Yeah, they've gotten it.
Have their own people going in to vaccinate. So it's not just local health departments.
Okay, so should the general public reach out or wait for the Board of Health, like the elderly? So should they reach out to their primary care? They just need some assistance. They don't want to wait till the middle of February, March. Should the general populations of 65 and older, it was a question asked to me, reach out to other aspects or wait for ours? Does anybody understand? I mean, am I asking it okay? I mean, should they reach out? They're getting nervous. Other towns, other states, should we just sit tight and wait because we're so good with our flu clinic? We're so good with everything else, but the rollout of vaccine seems to be a little slow for the state of Massachusetts. I mean, so should somebody like me reach out to my primary care, 71 years old, or should we? What do you recommend for that generation? They're getting very impatient.
That
Okay.
population phased approach isn't open yet. So unfortunately, the answer right now is to sit tight. We will be using all of our resources to get information out there when we will. Our hope is to have those large, massive clinics like we do with flu. We think
that's worked very well.
We think that will probably be more in the spring. If people haven't already signed up for the Swift Reach system, which is the town's call system where we can call out information, they used it a lot during the elections. So if you haven't signed up for that, that would be something to sign up for because we'll be putting out information through that, and it can go to your phone, your email.
Could you give me that information, Sigal, or could you put it?
It's on the town website. Swift Reach is the name of the system. So that's an action people can take, is to sign up for that reverse call system.
And that's for COVID update vaccines?
Nope, you just sign up for the system in general. And when we are able to have those large clinics for general population, or even targeted, like you said, for 65 and older, then we will be putting information out through there. Also, I understand not everybody, goes to the internet, but that the state website is also a great resource because they can identify open clinics like the one at Gillette, that as we move through the phases, anybody will be able to go to those. We will probably target ours to Norwood residents, but that things like the Gillette clinic is a state-run clinic that will serve anybody once they're eligible.
Okay, once they're eligible. So that's the thing, you don't jump. So you had sent out a very definitive graph that the state had sent, 3 categories. So they are still going by those categories. I mean, so we're not even into phase 2 yet of vaccines.
Correct. We're not into phase 2. We're almost done, almost to the last 2 bullets of phase 1. And I would say the image I put on the report to the board has already changed. So that first bullet point in phase 2 now includes people in the housing. And again, why the state is doing this phased approach is to have more equitable distribution of the vaccine. If we just open it up to anybody, first of all, we wouldn't be able to handle that capacity. And second, those that have resources would be able to get it first. And those that, like senior housing, do not have the same resources and are at higher risk, not only because of age, but also because of living situation.
Right, so we're not going to be standing in lines like, the news says, you're standing in line in Florida overnight for a vaccine. It's going to be a symptomatic system like our flu clinic. You either call, you sign up. Stacy has clearly stated what she's done at the fire station. Well, you all have done, and it works so well. You bring in a couple of extras. I think the town needs to know that process is already in place. We're just waiting for the next phase and the next doses.
Yep, and it will be an appointment-based system. So we have an online clinic management and registration system, and you have to have an appointment to show up. And that's really because of the logistics with the Moderna vaccine, they come in 10-dose vials. And once you open a 10-dose vials, you have to use those 10 doses within 6 hours. So we really need to control the numbers by factors of 10. Now, when we run those large, 100, 200, 300 size individual clinics, 300 population clinics, we'll have a good amount of appointments, but it'll all still be appointment based.
Boy, there's so much. Stacy, thank you. Thank you, Sigal. Thank you, Nick. Thank you, Katie. Thank everybody for what they're doing. It's overwhelming some days to see the updates. And like you said, Sigal and Stace, they change every day. I mean, it's very difficult for us to keep up with it, let alone the general public who says, well, why did you say that one day and now it's different the next day? I don't know.
And I just
right?
wanted to
I mean, Nick's shaking his head. Yeah, makes us look like, okay, well, you said that yesterday. Now it's not true today. I can't help that. It's the way the system's coming through.
Yep. And, the more we learn, the more we adjust. And it's not only with the vaccine, it's been with the whole COVID response. The more we learn about the vaccine, the more we can adapt our response. I just wanted to elaborate on one more thing. We talked about sort of the recommendations at the federal level and then the state phased approach. So the CDC issues guidelines to the state on how they should distribute the vaccine, but it's actually the jurisdictions of each state to determine their own phased approach. So state to state, you will see different approaches on how the vaccine is phased out. So just to elaborate, because we have heard, like Stacy mentioned, in Florida, that they just opened it up to anybody 65 and older.
And some people are saying, well, now when the president gets inaugurated tomorrow, the new president, that we're going to just have one shot. So do we variate from that? I mean, do we still give 2 shots? Do we give 1 shot? Is it going to open up faster if, President Biden says that we can start vaccinating everybody, even with the second shot? Do you know what I mean? That we're going to use the second shot as a first shot for the general public. Does that come through?
There's been a lot of media attention on that, but there's been no actual directive either from CDC or the state down to us of that change. So we do expect that, and we will continue that, assume we're going to be doing the 2 doses for everybody. And on that line, we will be running a second clinic for our first responders 28 days later for them to get the second dose. And we do ask those people that register for the clinic that they are committing to come back in 28 days for their second dose.
Right. Okay, I think I'm done with my list. Thank you. Thank you all.
Kathy, you muted.
Oh, listen to Joni tell them.
My internet dropped off completely, so I lost everything. Screen, telephone, everything, but back on now. So moving forward, public health nurse report, Nick?
Hello, everybody. So a lot of what we already discussed is kind of what consumes the nurse report for this month. Obviously, COVID vaccine is the hot topic, and Sigal had already mentioned it, but the best place to check when you're eligible, when you're going to be, when you'll estimated you'll be able to get the vaccine, who is eligible, is mass.gov/COVID vaccine. Again, we kind of touched on this already, but there will be, in addition to the local level clinics, there will be state run quote mass vaccination sites that will be that some have already opened, that if you have been activated for vaccination, you're eligible to get vaccination now, that's another location at which you can go to get the vaccine. Some of the sites will require identification to prove that you're eligible to receive vaccination. So for example, if you're a firefighter or et cetera, you'd have to bring, you can go to the mass.gov website I referenced to see what sort of identification you would need to bring. And it's on the website as sort of like a Google Maps of, it shows which clinics are the state-run sites, and so the closest one to us is the Gillette Stadium, but there's also Atrius Health in Needham, which is going to be running a state-run site. You do have to go online and make appointments to go to those sites as well. It's not just a show up as of right now, and you can make those appointments through the mass.gov website. It will give you the link right to go through and make the appointment. So obviously, like Sigal said, COVID-19 case investigation is still a factor of what we're doing. More of it has gone to the Community Tracing Collaborative, which is the state's sort of overflow support. So more likely than not, if a resident tests positive, they can expect a call from what's called the Community Tracing Collaborative to discuss the specifics of their situation with them. As far as testing goes, mass.gov/get-tested is still the website to go to find lists. It's also set up just like a Google Maps of where you can go and get tested, whether or not you need a doctor's order or you can just show up, an appointment, etc. It's all on that website. Blood pressure clinics. So we are still hosting those at the senior center. The next blood pressure clinic is going to be on the 27th, which is a Wednesday. And we run those from 11 to 12. So we've been doing the second and fourth Wednesday of each month. And we anticipate doing this the 27th as well. And then the last bullet is flu vaccine. We still do have flu vaccine. If any residents have not received their flu vaccine yet, if you need to make an appointment for it, and they can call Jen at 781-385-9197 to make an appointment for the flu vaccine, and we'll continue to do that until we run out, basically, of the supply.
Okay, I have questions for Nick on the other side of this paper, specifically for Nick.
Sure.
Nick, contact tracing.
Yes.
Again, brought to my attention, a lot of the towns aren't sharing. If somebody lives in Walpole but works in Norwood, their test results go to Walpole, but they're not sharing that information. So it kind of sets the pace back a little bit on how to maintain this virus. So if somebody worked for us, they lived in Walpole, we wouldn't know that they have it. Is there a, I mean, how does that work that we're not notified? You know, they withheld that information.
So it is a challenge, yes. If let's say a Walpole resident works here in Norwood, you know, just like contact tracing we've talked about before, it's still, you know, contact tracing is kind of the honor system. So one would hope that if an employee that is a Walpole resident resides here in Norwood, that they would let their employer know that they have tested positive, and the employer is supposed to notify the Board of Health. So there are backstops to that. So, you know, one would hope that Walpole would, you know, recognize that and share it with us. And I'm not picking on Walpole, we're just, you know,
No.
an example, you know, but yeah, so I mean, it is, you know, with the system we have, just like contact tracing too, it is an honor system. So certainly if any resident that does work in person tests positive, please let your employer know that. And it's, you know, specifically so that we can see if there were any exposures at the workplace if you are working in person. It's not, you know, it's not to penalize anyone. It's simply to figure out who, you know, who's been exposed, to help them find out how to get tested and take the precaution of quarantining if they met that definition.
And then their
definition
employee would then call the Norwood Health Department if they're working in town. Is that correct?
They would notify their employer. They would notify their employer.
Then their employer would notify the health department, with the town they work in.
Correct.
Okay. Schools. Could you please explain for the town of Norwood, hopefully they can hear it. I know that the superintendent sends out an announcement. If your children is pending a test result, not to send them to school. So, I mean, I think that has to, if you can inform them again, the procedure for somebody in a classroom that has had contact with somebody in school but is waiting for a test result. I understand they've been going to school, waiting for the test result, then take them out.
Yeah, so this is going to spill into our concept of the honor system again, Carolyn. So this is so yes, so certainly if someone, and I want to make sure I clearly define this, if someone is found to be a close contact, that That's the level of which, that we do have a specific definition for that. A close contact is someone that was exposed to such a point that they should be quarantining. So if someone has been told to quarantine, they should not be going anywhere until they've been released by whatever public health authority is following them. If, for example, in what you were talking about is, let's say, a kid was with their uncle that, and they find out that the uncle's positive and, we're going to go be safe and get tested, but they haven't been identified by a public health authority or something like that. Again, it's honor system. If you went and got tested, you should not be sending, if you got your kid tested, you should not be sending your kid to school until you get the results of that test yet. And again, I just want to differentiate too. There is this whole complicated web, which, we do discuss with someone that is quarantined about, getting out early with testing and what have you. That's different than the scenario which I'm talking about. This is self-reporting. This is the honor system. If you go and get your child tested, if you're a staff member and you go get tested, you should not be in person at the schools until you get that test result back. Specifically to avoid exposure, because we know, particularly with young kids, we know there are a lot of young kids that do not display symptoms. So you can't
it definitely
make the
falls
assumption.
into that honor system again. Yeah.
Yes.
And where can they be tested? Are we still looking for the PCR, or a rapid test is still sufficient for with school entry?
So I would strongly encourage the PCR. It is the most accurate test. However, the guidance that
That's the thing. However, I mean, that's that. However,
I know, and there is, the specific situation that I think we might be referring to is persons that are in quarantine. The Mass Department of Public Health has said that, and again, you would discuss the specifics of this with whatever local public health authority is following you, but the Mass Department of Public Health has said that a rapid antigen test is acceptable for the test out option with the quarantine. I would still say I strongly encourage the PCR test. And then I think Carolyn, you asked where people can get tested. Did you say that?
Well, I want to know if the urgent care on Providence Highway, because I hear different things. It took 4 days, it took 24 hours, it took 20 days. What are they doing up there? Are they doing all the same, or are they doing it on request? I want that.
So
what are they doing?
The urgent care, I think the one you're referring to is Norwood Urgent Care across from the Walpole Mall. They're doing PCR testing.
So the turnaround time is less now for PCR.
Yeah, it's
and
not
5
as
days.
bad as, say, when we talked about this back in August, but 3 to 5 days is the average I would say that I'm seeing out of there. I still, the fastest testing sites that we're seeing would be either the Norwood Hospital site, which is again on mass.gov/get-tested. It's a more restricted site. Your doctor has to order the test and they contact you, but you can also look at the Stop the Spread sites on the mass.gov/get-tested site. Their turnaround times are very fast. Those sites do change over time, so you really do need to check the website to see where the closest location is. And the Stop the Spread sites are good too if you had any concern whatsoever about insurance coverage or anything like that. That if your insurance doesn't cover it, that the cost is just absorbed by the state. So you would not.
The Node Hospital is working out very well. I get good feedback from that. Very well.
And in good testing times. Yeah.
I'm done. I'm going to rip it up. Thank you, everybody.
Can I just say something about the schools?
Sure.
So Gal and I have worked very closely with the school committee to set up a whole graph of what they should be doing, what parents should be doing, what teachers should be doing, how it's reported. It's on the school committee website. So if you have people, Carolyn, that are asking you those types of questions, they can see on that website. Plus, I think most of the schools, they were sent out to the parents so that they could follow what they were supposed to do. So
not everybody's on social media, Kath. That's why I wanted Nick to verbally make.
But I think they sent a copy of it as well. So what I'm saying is that a lot of this is, as as Nick was saying, is relying on people being honest and telling. So that's a big piece of this. But Sigal and I worked with the school committee to make sure that they got a lot of this information. So, you're going to find parents who are going to do what they want to do regardless. So it is an honor system, and we have to hope that people are following that honor system.
Right. When this broke out, and I was talking to Stacy probably daily, and I said, well, how can you believe that? And she reiterated to me, Carolyn, it's an honor system. We can't make, it's what they told us. But it's not always as it appears that way.
Yeah.
I'm done.
Nick, I do have a question for you in regards to flu. Have we had any positive flus?
Very, very few.
Okay.
Very few. The definitely, and we have found so far that the overall level of flu transmission this season has been low, and I think part of that is attributable to the precautions we're taking related to COVID. Mask wearing, hand washing, social distancing. That is also great for stopping flu transmission. So it's been low.
That's good to hear, because we don't need flu on top of COVID.
No.
Okay. Any other questions for anybody? Okay. Moving right along. Impact Norwood Program Director Report.
Hi, everyone. I'm stepping in for Aubrey today. So we had a couple updates we wanted to share with all of you. First, we wanted to remind everyone about the podcasts. So we've recorded 6 podcasts so far. All of them are on the Impact Norwood website. The website is impactionpodcast.podbean.com. You can also just find it by visiting the Impact Norwood website. It's got its own webpage. And so feel free to share that link and that resource with anyone you think may be interested. We have more podcasts planned with someone who specializes in social emotional learning. And then we have another one on brain development. So stay tuned for those as well. In terms of the Minds Matter Coalition, as we mentioned at our last meeting, we developed a community needs assessment, and we'll be planning to send that out in early February just to get a better sense of where people are at in terms of mental health. We know that the pandemic has really changed people's mental health levels, so we want to get a better sense of where people are at. And the goal behind the survey is to hopefully identify strategies or programs or resources that can continue to support mental health among our residents. And so the survey will be available in 5 languages. It's English, Spanish, Portuguese, Albanian, and Haitian Creole. And additional languages are available upon request. And Aubrey and I are also working on a grant application from SAMHSA that's focused on expanding mental health training for the Norwood community, which we're really excited about. It's due in a few weeks, so we'll be submitting that shortly as well. And then in terms of the Impact Norwood Coalition, we recently had a meeting. It was on January 14th, where the group and the coalition members had an opportunity to hear about some of the activities we've been doing. We're really hoping to recruit new coalition members. So if everyone would help us spread the word to anyone that's interested in volunteering, it doesn't matter how much time they're able to provide. They can visit our Impact Norwood website. The website for that is impactnorwood.org/volunteer. There's a form they can fill out, and then we'll get their information and can contact them via email. And then 2 last updates. For the Youth Ambassador Coalition, we're continuing to meet virtually. For the middle school students, we're meeting on Tuesdays at 3, and for the high school students, we're meeting on Fridays at 3. And then once a month, we have a joint meeting where the students can meet one another, get to know each other, and help to bridge the gap while everyone is still remote from school for the most part. And we're beginning to work on the social marketing plan for us to launch the Social Norms campaign. We're hoping to launch that in early March, so be on the lookout for that. The students are really excited about it, and they're excited that it's finally coming to fruition. They've been working on it since the summer, I believe. And then similar to the Impact Norwood Coalition, for the Youth Ambassador Coalition, we're also looking to recruit new members. And so the students are helping us spread the word to other students and friends they have if they're interested in joining the program. We have 20 students enrolled currently that most of them attend very regularly, but we're hoping to have more representation from every grade in our meetings, just to help build sustainability of the program, because we do have many students that will be graduating in May. And then the last update for Impact Norwood is about mental health support. And so we've heard loud and clear from students and teachers and school administrators that mental health is important right now during these times for the students in the middle school and the high school. And so Impact Norwood is hosting another guest speaker in early February from the Active Minds organization to speak to the middle school and high school students to continue to support their mental health. So we're excited about that.
Wow, lots going on.
Thank
Yeah,
you.
it's busy times.
Great report. Thank you.
Thank you.
Okay, moving along. Sanitarian report. Angelo, do you want to start off with the new food establishment report?
Sure. Every establishment on this list, as you see, they're all pending. I think the closest one to being inspected is Active Day of Norwood. So everybody else here is pending on this list. If anybody has any questions on the new food establishment report, just let me know.
Nick, Angelo, how's Spot doing?
Spot is, heard last week, he is planning on opening in March, sometime in March at their new location. Their old location is currently closed.
Right.
So that's the plan.
Okay. Thank you.
Welcome.
Okay. So you want to move on to your inspection report?
Sure. I'd say the one location that I like to do an update on is As Good as It Gets. They had several criticals during my last inspection there. Did have a re-inspection there as well. They did correct all the items there, but I'd feel better if I go back and just do a follow-up and have an update for the next meeting.
Okay.
How about the Paradise Biryani Point?
And which page is that on?
Page 2.
Page 2?
Yeah, it concerns me that they had no hot water in their hand sink.
Yeah, I did go back for a re-inspection on the 22nd. And all the issues from that inspection were corrected during my follow-up visit.
Okay. I just wanted to ask you, Nick, what does it mean when it says that the next complaint we receive regarding the same issue will result in an unannounced site inspection by our department? What do you mean by that?
So
I noticed-
the first COVID complaint we receive, for example, if it's a face mask requirement, so if it's a first complaint for an establishment, whether it's food or non-food related, we start with a phone call. So
Okay.
I initiate the phone call with the establishment. And any complaint thereafter regarding the same issue will result in most likely myself going out there for an inspection of the facility at that point.
Okay, but there's no tickets involved or?
No, so during my first visit, if I see non-compliance to the same issue that I called them before about, it's a written warning. It's a written consultation, so to speak.
Okay,
And then the third call I get for the same issue, if I go back a second time physically and I actually see non-compliance for a second time, that's when the fines do kick in. So it's escalating enforcement regarding our COVID response.
my next thing is, did we recheck Daddy's Dairy as far as them labeling their foods?
The follow-up is scheduled for tomorrow afternoon.
Okay,
So there'll be an update on the next board report for next meeting regarding.
okay.
Yeah.
The only question I have for you, Angelo, is did all of the schools get their updates on their choke save?
I believe
class?
the class, yes, the class was conducted. I'll reach out to Eli and ask him
Okay.
if that's completed. So I will have an update for the board during next meeting regarding that.
Excellent, thank you.
Okay. You're welcome.
And-
Anyone else have any other questions? Go ahead, Joan.
On the list, do we think that Westbury Farm should be put on there where they have a new owner and whatnot, and he's already had some problems? Do you think we ought to put them on the list and kind of stop in and say, hi, how are you?
Sure, I could do a follow-up for the board. That's fine. They'll be on the update list for next meeting, okay?
Okay.
And what about Wendy's? Can we take them off of the list, or do you feel that they need to continue?
Sure, no, Wendy's we can take off the list. Crushed Peppers as well.
Okay.
They met with the selectmen virtually on December 8th. So the owner has officially taken over that location. So we can take Crushed Peppers off the list. We can take Wendy's off the list,
Okay,
as well as Kissabor Latino Market. The debris outside has been removed from the establishment on the side of the exterior. So that's all set as well. We could take them off the list. And we're going to add As Good as It Gets and Westbury Farms for next meeting on that list.
very good. Any other questions for anybody?
Segal?
If I could just add on, if you notice Angelo's written report, and this is kind of, I'm also taking off my report, I do want to draw attention to the fact that we still are doing a lot of COVID response to complaints. And Angelo's out there, in addition to all his duties, doing the food inspections and pools, he is our boots on the ground as far as responding to those complaints. So those can get pretty extensive, and he's outlined those in his written report also.
Excellent, good job, Angelo. I know it's tough for everybody out there. Okay, so moving on to the director's report, Segal.
So most of it was covered in the COVID update, and the last thing I did want to talk about was that the governor did expand his orders. Just look at my report here and pull it over. So they did extend his orders through January 24th. I would expect that they're going to be extended again, and the most recent one was limiting capacity to 25% in most establishments. So I don't expect any changes, except for the fact that I do expect those to be extended, as we're not really seeing an improvement in the numbers that would justify any sort of rollback of any of the restrictions. Things look pretty level. They are still increasing in some indicators, but we're not seeing the dramatic increase we saw a few weeks ago. But they're not going down either.
I guess that's a plus.
Always try to find some bright side of it.
Yeah. Okay, board's agenda. Joan, do you have anything?
Nope, I don't.
Carolyn?
Oh, I had an agenda. I read them both sides of the paper. I'm all set. Thank you.
Okay. I just want to thank all of you for your hard work. I know this has been tough, and it's probably even tougher working remotely and not in your offices. But thanks for doing a great job and for keeping the town of Norwood safe. I just want you to all know that we do appreciate what you're doing. So, the other thing is we need to set up another meeting, 2 more meetings so that we're ahead of ourselves here. Do we want to set up, we have February. Do we want to do March and April?
Yeah, let me look at my book.
While everybody's looking at their books, Madam Chair, I just had, 2 more updates that I forgot.
Okay. Go ahead.
We are changing our virtual meeting platform to Zoom. So our next meeting will probably be on Zoom. Now that
Okay.
Joan got GoToMeeting, we'll be switching her to Zoom.
Okay.
Hey.
Just when he gets it down. Okay.
And also just have to mention, happy birthday to Jen. It is her birthday today.
Oh, happy birthday, Jen.
I'm not gonna ask.
you.
Okay, so what's a good day, March? I cannot do the 16th, so maybe the 23rd?
Did we do February and I missed it?
February is the 16th.
Okay,
unless we need to change it.
okay,
No.
thank you.
Okay.
March, you want to make what?
Can we make it the 23rd?
Okay,
Yep,
yep.
That's okay, the 23rd? And how about April? Do we want to go at least out to April? We do the
Okay.
20th?
yep.
That might be April school vacation, but I don't think we're
Oh, we
gonna
got-
be anywhere yet.
Oh, Lord, okay.
Okay, so it's the 20th?
That works for me. I don't know about anybody else. That work for everybody else?
But yeah,
Yep.
good for me.
Okay,
Okay,
so March 23rd, April 20th for the next two meetings. So,
yep,
a motion for
I make a-
adjournment?
yep, I make a motion, we join the meeting.
Joan, do you want to second it?
Second.
Thank you, everybody. Thank you,
All in favor?
Nick,
Thank you.
Stacy,
Thank you.
Francesca, Angela,
Good week.
thank you.